The erratic heartbeat for me was like a jazz drummer beating on my heart. It was very scary. I developed what's called atrial fibrillation, where it's an erratic heartbeat, very uncomfortable for me.
Atrial fibrillation is a chronic progressive disease, and when it's treated late in the process, the patient may need more than one ablation.
Dr. Ishmael did several ablations on me, and they didn't have lasting effect. Dr. Ishmael said that, Tom, now I can deem you as persistent atrial fibrillation. There are other levels of care, and he introduced me to Dr. Mineta, who was able to describe a next level surgery for me.
The procedure is a robotically assisted ablation of the heart, or a modified conversion procedure. We use small instruments about the size of my finger. We go and work between the ribs, and we open the pericardium, which is the sac surrounding the heart, and we actually take a device and place it on the heart and perform ablations to prevent atrial fibrillation.
It's just a minimally invasive procedure that I could recover from fairly quickly, and I did. After the surgery, I was up and about that day, and then out of the hospital within 3 days.
We have a multidisciplinary approach that can really help us in the treatment of atrial fibrillation. This is a great example of having all the tools necessary to treat this very difficult and complex disease.
It's amazing seeing patients like Tom. He was very apprehensive, and now that his atrial fibrillation is gone, he has a much better outlook on life.
Right away, my life was changed. And today, I have a bright, healthy future ahead of me because of the teamwork and the technology at Northwell Health. This surgery for me was life-altering in a good way. I have a new life now, and I'm so grateful that surgery like this exists for people like me that can get relief and have a good life.